My name is Heun, I'm a consultant psychiatrist, and today I would like to talk about autism. The term currently is not used as a yes or no, as autism and not autism, but autism. First, it covers several disorders, and on the other hand, there's an overlap between normality and people being autistic. There's three main features, which I will explain in detail later: abnormal social relations, abnormal communication, and restrictive interest of activity. And I explain the symptoms of these. Abnormal social relations means disturbed nonverbal behavior, poor eye contact, impaired thinking, and as a consequence, the problem and the failure to develop a peer relationship. Very often, for example, humor is not understood, intentions of others are not understood, and this leads to the fact that autistic people cannot develop clear relationships. They sometimes don't understand what other people think, which means they have no image of other people's thoughts, or they lack what they call in schizophrenia is called the theory of other people's mind. They also have reduced interest and reduced interest in shared enjoyment, such as building something together. They prefer singular individual activities. There is lack of social or emotional empathy. So when someone else hurts himself, and then the autistic person doesn't really understand or understands how the person who hurt himself feels, and sometimes cannot understand the sorrow and pain others might have. Sometimes there is attachment to unusual objects that might be specific leaves, might be animals, or might be toys. The second area is abnormal communication. There's very often a delay or a lack of spoken language. Sometimes there's a difficulty in initiating and sustaining conversations. There's sometimes a repetitive or stereotypical language, or some language which is only understandable to the person himself, which is idiosyncratic language. Mothers and fathers or family members, close family members, might understand these words, but others might not. Sometimes there is a lack of appropriate fantasy, and they don't understand the symbolism or the social part of play. The third area is restricted interest or activities. So people with autism have specific interests and preoccupations. An example might be that a child or some person might only be interested in watching specific cartoons. Cartoons are very often seen or watched by people with learning disabilities, and especially people with autism. And sometimes they watch the same hundreds of times. And they have no interest in watching others, and they might not understand jokes and comedy. Sometimes they take things very literally, so they wouldn't understand sentences like, I have the blue today. So they would look for the color, not for the emotion. Right, sometimes there is resistance to change, non-functional routines or rituals, or motor mannerism, stereotypic movements such as continuous hand or finger clapping or body rocking, or, as I said before, preoccupation with specific things or parts of objects. Neurologically, there are very often seizures, motor tics, increased head circumference, and an abnormal gaze monitoring, and sometimes People with autism might be ambidexter, so they use the hands in of both sides in a very similar way. In cases mostly it's normal to have one preference for one hand, and sometimes this specification for one preferred hand is not developed in people with autism spectrum disorder. There might be different physiological features such as intensive sensory responsiveness to bright light, loud noise, rough textures, so they might avoid these things. There might be an atypical or low response to pain or injury. The temperature regulation might be disturbed, and they might have a different perception or reception of illnesses and might be more ill than others. Behavioral problems are what the family can suffer with. A patient with autism spectrum disorder might be very irritable. They might have very aggressive tantrums. They might self-harm. There might be some aggression and hyperactivity, and all these things can affect the family and the social life. In rare cases, there might be specific interests, islands of interest, and very specific abilities, and possibly a very good memory, or sometimes very good arithmetic skills by multiplying or adding or something like that, which is very good and special, but very often has no functional consequence. So these are the symptoms. From what I would say, the first three are more or less the most important one, which are the poor or abnormal social interaction, the change in language and communication, and this restricted and stereotyped or repetitive repertoire of interest and activities. The other symptoms, neurological, physiological features, are not relevant for the diagnosis because it's a clinical diagnosis. Thanks for your interest, and I hope you learned a little bit. Thanks a lot. Goodbye.